you going? How you doing?
Wendy, we miss you. No, but seriously, plastic surgery tourism. Let's talk about it. Medical tourism isn't a new concept. I know we may seem like we're seeing more and more women go to the DR for their BBL, but we've seen medical tourism in the past, just in a different form. So for example, if you lived on a farm in the middle of nowhere, but needed a heart transplant, you wouldn't necessarily go down the street to Doc Martin to have him replace your heart. You would travel the 1 to 2 hours to the city nearby to go to specialists. Another example, if you say you had breast cancer and you wanted to see the world's experts on breast cancer, you might travel on a plane 8 to 10 hours to go see what you are saying is a world-renowned oncologist. So we've seen these examples in the past where people from typically resource-poor areas, and the resource here is medical resources, right, travel to resource-richer areas for their care. In plastic surgery, we're seeing the reverse. So people from typically or historically resource-rich areas are traveling to resource-poor areas for their care. For example, a woman who lives in LA and lives very close to Beverly Hills decides to travel to Tijuana, Mexico for her BBL. So let's talk about the why. So there are typically 2 reasons why a person would travel in that way for care. So one is that there are some destinations that are just known for that particular procedure. Thailand is known for transgender work. Brazil is known for butt lifts. Turkey is known for hair transplants. So you may find traveling to those places because you are more likely to find an expert in their field in that specific realm. The other reason, which probably is not shocking, is the cost. So based on medicaltourism.com, here are some cost differences for what it costs to get a certain procedure done in the US versus another country. Rhinoplasty. If you wanted to get a nose job in the US, the average cost would be $6,000. If you were to go to Colombia or Mexico, then that cost would be about half. Liposuction would cost you about $5,000 on average in the US versus $2,500 in Mexico. If you add to that even within the US, there's large variation. So for instance, Miami has come up as a place where people can get more cost-affordable liposuction. Then you really do understand why there is a trend to go to a different area and be a tourist just for the surgery. Now, when I'm quoting these prices, I'm not quoting the price of travel or the cost of lodging or eating in a different place. But people typically find that even if they add in these costs, they've shaved some money off of what they would have paid had they stayed at home to get their surgery done. But what's the real cost? And let me preface this by saying that traveling to Mexico, Miami, DR, Colombia does not inherently mean that you're getting unsafe surgery. So I don't want to put that out there as a narrative. There are a few ways in which surgery can become unsafe. So one is, if you as a patient pick a doctor who isn't discriminating. Just because everyone wants a mommy makeover doesn't mean everyone is appropriate for a mommy makeover. If you're looking at spending 6 to 8 hours under general anesthesia, your surgeon has to make sure that you are safe, that you are optimized, that you are the best that you can be for such a surgery. And if you don't pick a person who is discriminating, that makes the surgery inherently more risky. By the same token, if the person isn't qualified as a professional to perform the surgery in the first place, meaning they aren't a plastic surgeon, they aren't board certified in plastic surgery or the equivalent in their country. If you aren't able to verify the credentials of the person performing the procedure, that makes it inherently more risky. In the US, we had the resource abplasticsurgery.com.org. But very easily, you can go on there and look up, is my plastic surgeon board certified? And if they're not on the list, that doesn't mean that you rule them out necessarily. Doesn't mean blanket no. But it does mean that these people who are board certified have gone through the rigors of training, for one, and two, have been tested to make sure they are knowledgeable, smart, safe, and ethical. It's a hard process. But we who do it know that it means something to be able to say that I am a board certified plastic surgeon in the US. If they are board eligible, meaning they're within 1 or 2 years of graduating from residency and now they're trying to become board certified, that's very different from someone who's just not board certified, not board eligible. So please do that research before you pick a doctor. But if you're going to a country where you don't have abplasticsurgery.org, then it makes it really hard to verify the credentials. Unfortunately, it's very easy for someone to hang up plaques on plaques on plaques, many backs on backs on backs on backs. No, but seriously, you get the point. People can say anything, but we have to be able to verify. Trust but verify, right? And if someone's cutting you open at some point, maybe verify before you trust. And the third way that surgery can be made inherently more risky or unsafe is that the surgeon that you are choosing, the professional that you are choosing, is cutting corners in order to cut costs, but also at the risk of cutting safety measures. So an example of that would be doing a breast augmentation under local anesthesia. That's inherently more risky than doing it under general anesthesia. And there are some surgeons, and I want to use the word loosely because some of y'all didn't train to be surgeons. Some of these surgeons didn't train to be surgeons. They are just calling themselves surgeons. So so please just verify. Verify. It's your body. Please verify that they are actually qualified to do the surgery. And if someone's saying, I can do your breast aug under local anesthesia, again, I'm not saying that it cannot be done, although I would not do that, and I know a lot of surgeons would not do that. But I think if that's what is being offered to you, you have to ask yourself and that person the tough questions about how do you ensure that I am safe during the procedure? Is there a board certified anesthesiologist that is going to be caring for me when I'm under local anesthesia? Is there a CRNA involved? Who is involved in making sure that while you do the surgery, I'm kept alive and safe? So what does that mean? In the extreme, unsafe surgery means death. It could lead to death. You could die. And I know we all like to think that we will live until we're 100 plus and be in the news for celebrating our 112th birthday. I know I want to be in the news for that. But the truth of the matter is, some of us will die before then. And if you pick a surgeon who's unsafe, your risk is much higher of dying even before you could think about it. And we've seen that. We've seen that in the news. It's not unheard of. It's not something that seems so strange and so foreign a concept. It can happen. And unfortunately, it is happening. But let's say for argument's sake, you're not going to die. That's amazing. But there are complications inherent with surgery. Even with the safest surgery, the safest surgeon, the best trained, whatever, there are complications possible. Most complications will happen within the first 24 to 48 hours, but that doesn't mean that all complications happen within that period. So let's say you pick a 2-week trip to the DR for your BBL and you get through the 2 weeks just fine. That doesn't mean that you will not have complications still. Remember, it takes approximately 6 weeks to really recover from surgery and be back to your normal self, doing normal things. No restrictions, nothing. You living a normal life. Things like wound healing complications happen in the 2 to 4 week mark. And by that time, most people are already home. So what does that mean? That means they go to the emergency room and they get care from the plastic surgeon on call. And then that care could mean a revision that insurance might not cover. That care could mean a revision that insurance does cover, but then premium goes up for some reason. But that wasn't factored into the initial cost. Sure, you may save $3,000 because you went to Mexico for your rhinoplasty. But if you had complications at the 4 week mark and you didn't have easy access to your rhinoplasty surgeon, then what does that really do for your life? And again, this is not to say that traveling to the DR, traveling to Mexico, traveling to a resource poor area inherently means unsafe surgery. And this is not to say that you can't have complications with safe surgery. But the general idea is that you should be near your surgeon who did the operation within at least that first 6 week period to make sure everything runs well. And if it doesn't, that you have someone who intimately knows what happened, who can guide you through the process. So in my mind, is it worth it? Hell no. It's not worth it. It's not worth it. If you live in TJ, stay in TJ and get your surgery. If you live in LA, stay in LA and get your surgery. Go locally for your surgery. Verify locally that you are surrounded by good surgeons. Pick a good surgeon locally. How many times will I say locally? I don't know, but the point is, I want you to understand that you should get care locally if you can. But if you can't, ask the hard questions. Verify before you trust. But I know just because I say it over and over again, you don't know me from Adam, so you don't necessarily trust me to give you the good advice. And that's fine. I'm not hurt by that. But what I do want you to do is to be safe. So pick a good surgeon, hopefully a local surgeon. But if you can't and you want to save that extra $1,000, then at least verify before you trust and ask the hard questions. What are your thoughts? Leave your comments and questions below. As always, love you lots. Bye for now.